I'm going to start with a message from Ken Loach. I'm sorry not to be with you today, and thank you for allowing me to share these few thoughts with you. This is such a critical time, so many great issues to be resolved. One of these is this question: what is the future, if there is one, of our National Health Service? You, the people here, and key branches public, have got it right. Your pamphlet, Restore the People's NHS, is spot on. You are right to assert that the founding principles of the NHS are central to its future. We must never betray them. The NHS must be publicly owned and managed, and be entirely funded by progressive taxation. All its staff, from caterers and cleaners to consultants and managers, should be employed directly by the NHS with secure contracts, good pay and good conditions. Over many campaigns, you have explained why outsourcing and subcontracting fail both patients and staff. You correctly link social conditions and deprivation to ill health. You show why social care needs to be a national service, run on the same principles as the NHS. Your work is essential, timely, and your conclusions need to be heard. But now we must confront an inconvenient truth. None of the main political parties agree with us. Tories, Labour, Liberal Democrats, and let's not mention Farage. They all welcome profiteers into the health service. Labour's retreat on the NHS is the hardest to acknowledge, but we must face it head on. Starmer follows Blair in his commitment to the success of big business and the market economy. Where private companies can see opportunities to trade, they must be allowed access, and having access, they must make profits or fail. That logic is inescapable. The NHS is a prime market for profiteering. We have listened to Wes Streeting welcoming the involvement of private health companies into the NHS. He is unequivocal in stating Labour's position. Therefore, I think we have no choice. The Labour Party's NHS policy must be opposed, and opposed with all the strength we can muster. With warmest good wishes and solidarity, Ken Loach. Can we the first slide, please? We've been fighting privatisation for nearly 20 years now. We were set up, Keeper NHS Public was founded in 2005. Jackie Davis, that spoke earlier in the morning, was one of the founding members. That's a long time. You will remember that 2005 wasn't in a Conservative regime, it was under the Blair government, where private finance initiative was the method used to privatise the NHS estate of new hospitals, and independent sector treatment centres were set up to try to force the NHS to take on the private sector to address the waiting list. And we heard this morning from John that that initiative failed. It was an expensive failure, and it was the ability back at the NHS that rescued him, the waiting lists, not independent sector treatment centres. So we've been organising for years and years and years, and one of our methods is to have national days of action where our 50 groups now around the country leap into action, and on other occasions we've had even more events with the involvement of Unite Community and other organisations. And this is one of them there, Sunderland Beach for NHS 75. Where is that? Oxford, Manchester and Ealing and around the country. So that's one of our main methods in our sessions about activities, what works and what doesn't work. This is certainly one of our bread and butter things to get the message out to people up and down the country. We've also been fighting privatisation, as I just said. Next slide, please. And we've had national demonstrations, sometimes under the aegis of Health Campaigns Together, an organisation that we set up to link with trade unions, and sometimes with other organisations in a very strong alliance, SOS NHS, that was set up over 2 years ago. It was that demonstration in last year, 2023, that we had nearly 10,000 people. I seem to have lost the slide with that picture, but it'll come up next, I'm sure. Having heard the speeches, the very moving speeches from the NHS staff, which nearly got me able to speak at the beginning. Thank you very much for that. One of our main activities is to support NHS staff in struggle, demanding not just pay, but respect, proper conditions and proper pensions, and to be in the NHS workforce. So that's one of our bread and butter activities around the country, and thank you very much for coming today. We've been fighting, next slide please, we've been fighting on the issue of privatisation. The twin issues, as we know, the twin threats, and they are linked, are privatising of health services and underfunding of the National Health Service, so that then people start complaining about it and forced to go on waiting lists and maybe go private, and people complain that the NHS doesn't work, so it undermines public confidence in a public service. And that is conscious, and we must campaign against it. One of several demonstrations that we've held, this was a year ago, and SOS NHS, and we linked the strikes of the NHS staff up and down the country, nurses, physiotherapists, radiographers, ambulance staff, doctors, and we were out there on the picket lines, but we also in the middle of it had this big demonstration in London. And thank you, Tom. He's not going to thank himself when he winds up, but thank you, Tom, who's organised us over the last 6 years. And he's the main organiser of these demonstrations. The next item, please, is a huge, important part of our campaigning is our media coverage, and that's linked to, that's one of the reasons we discussed in our activity workshop. That's one of the reasons for demonstrations. Sometimes people think they don't work, they're ineffective, but one of the impacts, certainly created with Samantha's help here, is we got absolutely fantastic coverage in that demonstration. We had 5 national TV channels and loads of paper and radio coverage, and this is the kind of coverage we're getting now. We're in the news every single week. Next slide, please. We also campaign against cuts in services. Our main key branch as public highlights privatisation, but we also campaign against the underfunding of the NHS, the cuts, the redundancies and the closure of hospitals. And since 2012, we've actually saved 10 hospitals around the country. 10 hospitals. Women's Hospital. That is still a going entity because of that campaign. It would have been closed down long ago if it hadn't been for the campaigners there. Hands off HRI, if you can see that, the little one at the bottom, the hands off the Huddersfield Royal Infirmary, that also was saved. The battle isn't over for these hospitals, but it's saved, it still exists. Charing Cross Hospital and Ealing Hospitals were both due for closure, and their struggles have been gone longer than the Lewisham struggle here. They were threatened in 2012, and they gained the victory in 2018. Lewisham Hospital at the top was threatened with closure in 2013, and we had a huge community campaign, and we went to the High Court, backed by a demonstration of 25,000, and we won that. So Lewisham Hospital is still open. And during COVID, Lewisham Hospital was the first A&E where a patient just walked in with COVID, not knowing that they had COVID, off the plane at Heathrow, on the train, into a taxi, and into A&E, totally unprepared A&E, no isolation facilities, etc. And we got that into the press, and that actually changed things dramatically. So we campaigned for hospitals and other services of the NHS as well. Next slide, please. We're very proud, well, start again. The NHS is a single issue campaign, and yet it's so vast. It raises all sorts of other issues. It intertwines with social care, but it also intertwines with poverty, with homelessness, with the health of women, the rights of women, migrant health, and in COVID. So we've raised a lot of these issues as an important part exhausting sometimes, but an important part of our campaign to promote health and to save the NHS. In 2021, in other words, we launched the People's COVID Inquiry, and that was a full 2 years ahead of the opening day of the UK Public Inquiry. We had Michael Mansfield as the chair of our panel. I don't know if anybody hasn't been aware of that. It's all available online, and there's, well, the web was available. We had 44 witnesses of international repute and union activists and nurses and doctors and London Underground drivers, teachers and so on. And it was a fantastic event, and we gained a huge amount of evidence that we have shared with the UK Public Inquiry, with brief relatives, legal team, with the TUC, with the BMA, and they've also thanked us for that. Next slide, please. We've heard about migrant charges from Claire, and so I'm definitely not going to go into detail, but it's an important part of health campaigning to be defending the universal right to access to healthcare. And I'm sure Claire said this, but sorry to repeat it, but over 1 million people are undocumented in this country. Over 200,000 children are denied healthcare. Next, please. In 2018, we changed our KMP constitution and adopted the demand for public access, universal access to social care and support for independent living free at the point of use, in principle, like the NHS, but as a separate service. And you see Gilda in that picture there, and she's over there, and she's been fantastic in allowing this campaign to take off with the support of other organisations. We're very proud of that too. Next slide, please. We've heard about the fight against GP privatisation, and we've heard the media and the politicians are always saying GPs were always private, weren't they? So what are you going on about? Well, they might be independent contractors, but they have given their commitment and their lives to the NHS as independent doctors or groups of doctors. But what they haven't done is taken profits from that service. And what's different is when corporations that are profit-taking come in to take over chunks of the NHS, and as we know, 17 with the UK operative operas became the largest provider of GP services for over 600,000 people. A huge campaign in North London from our own teams went to a judicial review, and this is some of the activity that we took. We lost the judicial review, but we won the principles in our view, and in fact, one GP practice has now been refused to be given the contract to the private company in North London. Next slide, please. Mental health is huge. We heard it said earlier on what a travesty it is for politicians to be saying there will be an equal parity to mental health alongside physical health. That's never ever happened. It's been said by numerous politicians, prime ministers in waiting. We felt that we should try to give parity of esteem on the campaigning circuit to mental health. It stretches us yet again, but we had a hugely successful mental health conference held at the Royal Free Hospital in 2019, and it was really well attended, massive interest, and we were getting a kind of network together of interested parties, and then Boris Johnson comes in with the election in December, announced at the end of October, and that kind of took the impetus away from our mental health work. and on networking, which we need to get back to. But we're working with other people, and here is Rachel, who set up a charity called Mental Health Time for Action, and other patient advocates who talked about their experience of the South London Maudsley deteriorating savagely between 2010 and 2019, having had serial needs for admissions, and the services went from absolutely wonderful with great outpatient and community support to being in fear of their lives on admission, with the staff at night locked in the staff queues. And that's a really important issue that we haven't forgotten. Next slide, please. So, another perhaps more unseen part of our work, it has been referred to today, but we've got several working parties, very, very hard-working individuals. Many of them are in this room, on integrated care boards, integrated care systems, and a database that Greg here created. That's what that slide refers to. The primary care work group, which Brenda convened. Brenda's there. Work group on data. On data, on trade deals. Definitely a huge vote of thanks to all the working groups. But if anybody didn't know about those, they're all represented on the website under the tab campaigns, which Olivia over here maintains very well for us. Thank you. Next slide, please. So, we've come to the end of today. I think one of the messages we have to take, and Ken Loach has voiced it really, is that, and it was integral to our decision to develop a pamphlet with a vision for the NHS and the 14 fact sheets, in that we knew that whoever wins the next election, whenever it's going to be, and it's going to be in October when we organise the conference, whoever wins the next election, we are going to have to carry on campaigning. We have a mountain to climb, but we have a network of supporters up and down the country, both within Keep Our NHS Public and with allies outside of Keep Our NHS Public. We have to look at the party manifestos, and in particular that of the incoming government, which is inevitably going to be Labour, and we have to say this is not only not good enough, this is, if it carries on like this is a betrayal of the NHS and the people that need it. So our campaign to restore the people's NHS started when we first published it, but this is our first public launch, and I want to thank you very much for coming today, and please be an active member of our campaign in the coming months and unfortunately coming years, if you can bear it.